please explain in layman's terms how the gastric band works for weight loss?
There's three main methods of weight loss. First is gastric band, second is sleeve gastrectomy, and third is a gastric bypass. The gastric band is purely restrictive. It makes us lose weight by restricting the portion size that patients can eat. So with a gastric band, most patients on average would eat about 50 mils or half a cup of tea during a meal time. That works by making you feel full up when you eat smaller amounts. Sleeve gastrectomy involves removing 3/4 of your stomach, and the sleeve works mainly by decreasing our hunger. The bottom part of our stomach produces a hunger hormone called ghrelin, and once we take that part of the stomach out, patients feel less hungry. So a sleeve tends to work not by making you feel full up, by making you less hungry. The gastric bypass is an operation that involves malabsorption. So it doesn't affect your hunger, doesn't affect your full up feeling, but it stops you absorbing the food that you eat. And we do that by bypassing part of the stomach and part of the intestine. Overall, the operations, the gastric band is the most simplest and easiest and safest out of the three of them.
How safe is the operation? How long is the recovery? And roughly how many days would someone need to take off work?
The gastric band is without doubt the safest of all operations for weight loss. It takes 20 minutes. It's a general anaesthetic, so the patient is asleep when they have the operation. And the vast majority of patients will go home the same day of surgery. The ones that do not go home the same day, whether they're feeling a bit sleepy after the anaesthetic or a bit sore, they'll go home the following day. So all patients are home at least on the first day after surgery. Depending on how physical your job is, some patients are back at a desk job within 2 days. If patients have a physical job, it will take them a week before they're back to work.
Is it major surgery?
It's definitely not major surgery, it's minor surgery. So unlike the gastric sleeve or the gastric bypass, there is no stapling of the stomach, there is no cutting of the stomach. All that happens is we take this thing here made of silicone and we wrap it around the top of your stomach so that when you eat afterwards, we eat and fill that part of the stomach there. And as I say, the anaesthetic only lasts for 20 minutes and the vast majority of patients can go home on the same day of surgery. They do not have to stay in hospital.
Would it be considered open or a keyhole surgery?
It's keyhole surgery, and we call that surgery laparoscopic surgery. So there's 4 cuts the size of my fingertips. 1, 2, 3, 4. It's all done with instruments that are 5 millimeters in diameter. And as I say, because of the keyhole surgery and the quickness of the anaesthetic, patients can go home the same day.
Will there be much pain for the patient after the surgery?
No, most patients have simple Panadol post-operatively, so the only analgesia they usually require is Panadol, and they take that home with them.
How soon after the operation can a patient start eating?
So at weight loss, there's a whole pathway for the patients to follow. Not just for 2 or 3 days post-operatively, but we come up with a 2-year pathway for the patients to follow. For the first 2 weeks after the operation, patients are on liquids only. So for the first 2 weeks we would have water, tea, coffee, juice, soup, and they only remain on those liquids for 2 weeks. The second 2 weeks we progress to what we call baby food. So for the second 2 weeks we would have thickened soups, thickened yogurt, scrambled eggs, that sort of stuff. And then at week 4 they would get reviewed in the clinic, and providing everything was progressing well, that's the time they would start on their solids at week 5.
How many patients have had the gastric band operation, and how long has gastric band operation been performed?
The gastric band's been around for about 25 years now. Worldwide there's over 300,000 patients had this surgery, and I've personally performed 4,500 gastric bands.
How much weight can a patient expect to lose?
On average, patients will lose between 1/2 and 1 kilogram a week.
Wow.
The weight loss with the gastric band is definitely a lot less than a sleeve or a gastric bypass. You'll lose weight probably 2 or 3 kilograms a week. However, with the band, the weight loss will last for at least 2 years. With those other procedures, the weight loss tends to last 12 months. So long-term wise, the weight loss following a band or a sleeve or a bypass will be similar. It just happens quicker with a sleeve or a bypass.
Is the band for life? And if so, how long will it last?
The bands have been in for 25 years, so there are some patients that have the bands 25 years. It's made of silicone, it's very inert, so it can last for life, the gastric band. However, patients do choose to have the band removed, but I tell all patients before they have the band removed, the band should be empty and they should maintain their weight for at least 12 months before we take it out. What we don't want is to take the band out and put their weight back on again. So some patients who can maintain their weight without the band having liquid in it, they are offered the chance to have the band removed. However, not everyone wants the band removed. Some patients like that little safety blanket in the background so that should they fall off the wagon 2 or 3 years later, we can put the liquid back in.
Can the patient still eat the same variety of foods?
Yes, it just affects portion size of the gastric band. So it'll make you eat the same foods you always eat, just much smaller amounts. And typically patients would eat about 50 ml, so half a cup of food, or half a cup would be the amount of food they would be able to eat in one go.
Nutrients?
Yes, they do get enough nutrients as long as they follow the pathway the dietitian and myself set. So if you use that space appropriately and you put in the appropriate foods, there won't be any malnutrition with the gastric band. But it is important that they follow the pathway. One type of food they all have difficulty with is dry bread. Most patients will say dry bread is difficult, and that's just the stodginess of the bread, particularly as it swells up, it expands inside your stomach.
What happens if a patient fails to lose weight?
It's very rare the patient will fail to lose weight with a gastric band, and it's usually one or two problems. One is the patient is drinking high calorie liquids. So if the patient does not stick to the diet that myself and the dietitian have organised, high calorie liquids will flow through the band easily and they'll not lose weight. That's the most common reason. Those patients just need education, so they don't need anything else. They just need to be educated on what to eat. Not so much, but they just need to be educated, because if you eat good solid foods with the band, it makes you feel full up and it takes away the desire for the ice cream or the chocolate or the cappuccinos or whatever else, the high calorie liquids they're drinking. That's the main thing. So the main thing when a band doesn't work, it's not the band. It's usually the patient that has not adapted to the lifestyle the band requires. Second thing it could be is the patient's not come back to the clinic for follow-up. So if the patient doesn't come back to the clinic for follow-up and the band's not tight enough, they might actually be eating more than they should be, and it just means the band needs tightened. Either way, whether it's bad choices made by the patient or the band's not tight enough, if they come back to the clinic, those things can be sorted out.
What can a patient do to improve the results and get an even better outcome?
Just return to the clinic. If they come to the clinic and they follow the pathway with the dietitian, the exercise physiologist and the bariatric physician, they stick to the rules, they'll lose weight with the gastric band. If they don't stick to the rules, they will not lose weight.
Can the band be removed?
Yes. The band is very easily removed, takes 10 minutes. Same keyhole operation, put the band in as it is to take the band out, and you go home the same day. Once the band's removed, stomach will go back to normal, so they'll go back to eating exactly the same as they were before the band.
How are the adjustments to the band done, and is it painful?
The adjustments are done in the clinic, and it's very similar to having a blood test. So we use a little needle called a non-coring needle, and we inject the saline straight into the port, which sits right beneath the rib cage on the left-hand side. It takes less than a minute, and patients walk out.
Are there age limits to having the band?
The youngest patient I've put a band in has been 12 years old, and the oldest has been 70 years old. But it obviously depends on the health of the patient. Some patients are 70 and look 90, some patients are 50 and look 70. It depends on the health of the patient. 12-year-old boy, 145.
What happens if a patient becomes pregnant?
Band's adjustable, so the fluid can be taken out, fluid can be put in. During pregnancy, the mother has to eat for two, so she's no longer just eating for herself. So during pregnancy, a mother tends to need more nutrition and more food than she does when she's not pregnant. Most patients, not all of the patients, would have some of the fluid removed from the band. So typically if you have 6 mils in the band at a certain tightness, you would have 3 mils in when you're pregnant. And that just loosens the band, allows the mother to eat more food, and then once the pregnancy is over, we would tend to retighten the band. So the adjustability for pregnancy is very important. And I would say the vast majority of young females will choose to have a gastric band, particularly for that reason, specifically for the fact they want to have children in the future and they need it to be adjustable. The sleeve in the gastric bypass is not adjustable, and most women that are past childbearing age are much more likely to choose a sleeve or a bypass rather than a band.
How will a patient cope with eating out with friends and family?
First thing they have to do is only order an entree. Don't order any more than an entree, because an entree is all they'll eat, and it'll take them 45 minutes to eat that small amount. Second thing they have to do is chew their food. You have to chew your food really slowly, and I tell every patient that each mouthful should be chewed 20 times before they swallow. Don't drink with their meals. If you drink while you're eating, it will fill the space too quickly and you won't get the food in. So I tell most patients when they're out for a meal, do not drink for at least 45 minutes after they've finished their meal. Apart from that, they'll eat everything they can normally eat, so they'll be able to eat a variety of foods, just small amounts.
Can the patient still drink alcohol with the band?
Yes, definitely. Alcohol will go down very easily. The trouble will be with weight loss, that will decrease their tolerance to alcohol, so they'll find 2 or 3 glasses of wine and it'll get them flat on their back.
But it also like their calories, alcohol's like having sugar.
No. Okay. Red wine is terrible. White wine is awful. Beer is not too bad. I'm not sure I should say this, but all the shorts are pretty much calorie free. So if you're drinking tequila and vodka and whiskey, in actual fact, and it's not good for your liver, it'll give you cirrhosis, but from a calorie point of view, alcohol, it's the wines that kill us. Red and white wine are the true killers, but the shorts are.
Will the patient have to take minerals and vitamins?
Definitely not. We do a whole nutritional screen and metabolic screen before the patients have surgery to check that metabolism and their minerals are good. And quite a lot of patients have vitamin D deficiency before we actually do the surgery. We give them supplements for their vitamin D, but long-term wise, as long as they're following the rules the dietitian and myself set, there'll be no nutritional deficiencies with a gastric band. Should
the patient expect vomiting and reflux?
Definitely not. Any patient with a gastric band that has reflux or vomiting, it means there is something not right. They need to return to the clinic when that happens. It can be a number of things. It could be patient factors in that the eating too fast, eating too much, or not chewing their food appropriately. That would definitely make food stick and perhaps come back up. It could be surgeon-related factors. It could be that the band has been over-tightened and there's way too much liquid in the band, so it would have to be loosened. Or it could be that the band has actually moved out of position, but the stitches holding the band in place have actually burst and the band's moved. Either way, whether it's surgery or patient-related factors, reflux or vomiting means come back to the clinic to get it sorted out.
Will the patient need cosmetic surgery to remove excess skin after losing all of their weight?
Young patients that lose half a kilogram a week over a 12-month period will not require any surgery for excess skin because their skin retains its elasticity. If you're old, grey and grumpy like me and you're 50 years old when you lose the weight, it's less likely the skin will go back to normal, and those patients may end up requiring an abdominoplasty or a brachioplasty or a thigh lift. But the most important thing is to lose the weight.
Are there any success stories in your experience that stand out to you during your time of doing this procedure that really have changed a patient's life?
Yeah, there's one girl in particular I remember. She was about 42 when she came and seen me. She's an Italian girl, drop dead gorgeous. She was a beauty therapist. She was absolutely beautiful. And she spent her whole life, her and her Italian husband, trying to get pregnant and couldn't get pregnant. For whatever reason, maybe her weight, maybe not her weight. But she had a gastric band with me and she came in one day and she said to me, you know, I've lost 60 kilograms with this gastric band. I feel great and I can't believe it. I've gone into early menopause. And I said to her, what do you mean you've got? She says, my periods have stopped. And I sort of looked at her and said, have you done a pregnancy test? She went, no, I'm in early menopause, And I'm going to see my GP this afternoon about it because I'll have to go on that blooming HRT. Anyway, the next day she phoned me and she was 42 and she'd fallen pregnant for the first time in her life. And she was over the moon. She called her son Kevin and she went round telling everyone in Perth that Dr. Dolan got her pregnant. So when I seen her for follow-up, I had to say to her, you know, you might want to tell people Dr. Dolan helped you get pregnant, but don't tell anyone that Dr. Dolan got you pregnant because that doesn't go too well with the wife. And she always sticks out in my mind as a patient that, you know, I thought, God, she'd really changed her life just from having a simple thing put right in her stomach. It's completely changed her life. And she's always the one that sticks out in my mind.
She's also named her son after you.
I don't know.